In this video, let's discuss various important topics in RPD, right? So in the previous video, we've seen topics in FPD. So coming to topics in RPD, coming to the first subtopic, classification. So obviously, once you hear of classification RPD, you need to focus on Kennedy's classification and the modifications given by Applegate, right? So in classification, focus on Kennedy's classification, Applegate's modifications. We have a lot many questions from these topics in GSET 2014 as well as APPG 2016. And also various criteria for classification of partial edentulous ridges or partial edentulous arches asked in GSET 2014. So what are the criteria for classification? How should a classification be ideally, right? So that's another question we have. And also a question on support in case of partial dentures asked in COMET 2015, right? So these are some of the topics which you can focus on in classification. And coming to major and minor connectors, you need to be thorough with all types of major and minor connectors, their uses, indications. They're very, very important, right? So types, indications, advantages as well as disadvantages. And to be more specific, in major and minor connectors, you need to focus on the functions of minor connector asked in GSET 2014, lingual bar major connector asked in AP 2014 and MHPG set 2015, sublingual bar asked in AP 2013, lingual split bar type connector asked in AIMS 2013, distal extension RPD. We have a lot many questions on this distal extension RPD asked in AP 2014, and also a question on double lingual bar or Kennedy bar asked in GSET 2014, and various types of minor connector asked in COMET 2016. We have nail head type, we have strip type, mesh type, lattice type, so various types of minor connector, and also various drawbacks of non-rigid major connectors, right, asked in APG 2015, and also requirements of major connectors asked in Kerala 2016. So these are in specific the topics which you need to focus on, right? And then coming to another subtopic, rests, direct and indirect retainers. So in this subtopic you can focus on the following topics like reasons for failure of rest seat in RPD asked in AP 2011, various functions of rests asked in AIMS as well as BHU, various entrance exams, right? And what are the primary and secondary retentive features for RPD asked in AP 2012, and also the differences between a wrought gold alloy clasp wire and cast gold clasp wire asked in AP 2014, and lot many questions on indirect retainers asked in GSET 2014, types of clasps and their indications asked in APG 2014, blockout, different types of blockout and relief shape blockout, etc. asked in Kerala 2015 as well as MHPG set 2016. Also we had questions on the basic functioning mechanism or designing principle like levers and functions. Sorry, it's not functions, it's fulcrums, right? So we have questions on levers and fulcrums as well in Kerala 2015, and like based on what class of lever we are designing this indirect or direct retainer in case of RPD, right? And then coming to another topic in the sense shape of rests and rest seats. We have a lot many questions on shape of rest as well as rest seat asked in GSET 2014, AAPG 2015, etc. And also we have questions on the placements or designing or positioning of indirect retainers in RPD, and also we have a question on flexibility of clasp arm asked in AP 2015, right? So these are some of the topics which you need to focus on rests, direct as well as indirect retainers, right? And then coming to survey and design. So in survey and design, we have few topics like guide planes. So we have questions on guide planes asked in GSET 2014, steps in RPD, the basic steps, what are all the treatment protocol steps we need to follow for designing an RPD asked in AP 2011. And also a question on the amount of undercut required for a wrought wire asked in Kerala 2015. Also a question on dental surveyor or its other name. So it's a parallelometer, right? So asked in AP 2013. And question on various factors determining the path of placement and removal asked in BHU 2007, right? So these are some of the topics in survey and design. And coming to few miscellaneous topics in RPD, we have questions on physiologic impression technique asked in KSET 2012, altered cast technique asked in PGA 2012, various phases in partial denture delivery or surveys asked in Kerala 2015. We have around 5 to 6 phases, right? And also we have questions on various factors in selecting metal alloys for designing RPD framework asked in AIMS 2015. right? So these are some of the miscellaneous topics in RPD, right? So to summarize, we have discussed few important topics in classification, introduction and classification, major and minor connectors, rests, direct and indirect retainers, and also we have discussed important topics in survey and design, and few miscellaneous topics, right? So these are some of the important topics in RPD, and regarding the list of books which you need to refer, we'll discuss that in the weekly schedule, which I will publish that in the next subsequent video, right? So hope it's clear. So these are some of the important topics in RPD, right? So you make sure that you take a note of all these important topics, keep alongside with you when you're preparing, and make sure that you cover them during your course of preparation, right? All the very best.